Gentleman yields back. Now recognize Mr. Peters of California for his 5 minutes of questioning. Oh, didn't see you slip in.
That's
Yeah.
that's
Recognize Dr. Ruiz for his 5 minutes of questioning. He slipped in and he has seniority.
Stealth. It's what you call a good second baseman, just getting it done quickly. So thank you for being here. Thank you, Mr. Chairman. Congress established the Office of Refugee Resettlement in part because putting children in indefinite adult immigration detention is unconscionable. I think back to just a few years ago when so many children were kept in protracted immigration detention, often in literal cages and separated from their families. These conditions were so abhorrent that I introduced a bill, the Humanitarian Standards for Individuals in Customs and Border Protection Custody Act, that would establish minimum standards of care in these facilities and ensure these children had access to basic human necessities while they awaited further processing. Unlike in immigration detention, in ORR care, children are provided with housing, shelter, clothing, educational services, and medical care. Republicans this Congress have proposed transferring some of the ORR's responsibilities to the Department of Homeland Security, but that would threaten the well-being of unaccompanied children. Instead, we need to focus on how ORR can best meet its obligation to provide high-quality care for children, including case management services by trained professionals that can provide culturally competent, trauma-informed care to this vulnerable population. Last year, the Office of the Inspector General released a report that documented concerning deficiencies in case manager training and skills, and ORR has commendably made significant strides to address them. So, Secretary Becerra, what changes is ORR making to improve case management standards, particularly to ensure case managers are well-trained and have relevant skills to serve unaccompanied children?
Congressman, thank you for the question, because that's the core of our work. And now that we have gotten into a rhythm and figured out how to best try to make the process work, we're able to train to that. So that way we have a consistency. So no child is treated differently when it comes to having the same opportunity to be placed with a reliable, vetted sponsor. And so the training has improved. We're moving more towards, with technology, towards a faster way of trying to secure identity information about sponsors. We are providing far better care than several years ago for these kids. As you pointed out, we actually provide educational services, mental health services, things that were not provided before we started this process. And what we're doing is, while they are in our care, and it's only for a short amount of time, they are at least being provided with the safety and well-being that they need before they go off to a sponsor.
And mind you, those are the services that the Department of Homeland Securities do not provide.
That's correct.
Last year, ORR faced an unprecedented number of arrivals of unaccompanied children. Even as the arrivals have slowed, ORR has to be prepared to adjust its capacity to establish emergency housing, take on staff, and provide services to children when regular spikes in migration occur. So what has ORR learned over the past 2 years about how to respond to influxes in unaccompanied minors and how to ensure that the office continues to provide high-quality care for children when there are high numbers of children crossing the border?
Well, Congressman, one of the first things we learned is you can't wait till you see the kids coming in to try to find a safe bed, a place that they can go. You have to be ready for them. And so we are constantly making sure that we have the services available for any child who comes in. We also now work closely with the Department of Homeland Security to make sure no child is coming to us, for example, COVID positive, and then interspersed with kids who are not infected. So we segregate children so we can protect those who are not ill. And so we have spaces and beds that are specific for kids who are positive for COVID or who may have other infectious diseases or who need particular medical assistance. So we've learned through the process and we have become far more efficient. And that is the really important aspect of this, because efficiency process means the kids ultimately will be in a home where child welfare experts say they should be, not in a congregate care setting.
And in response to the Office of Inspector General's concerns, ORR also made several improvements to the UC Online portal. OIG claimed that these deficiencies in ORR software could have increased children's risk of release to unsafe sponsors. So what changes has ORR made to the UC portal, and how do these changes enhance case management and reduce risk in the placement process?
Yeah, the portal is our way to try to collect that information that helps us verify. We have kids in our care. We have to try to place them with a sponsor. How can we be assured that we're going to place them with a safe and prepared sponsor? That portal helps us collect a lot of that information to make sure that we ultimately, when we make that release, that discharge is going to be a good one for the child.
Secretary, thank you for your leadership, thank you for your concern, and thank you for making these improvements.
Thank you.